Okay, so we can start. We'll start with some all CNA stuff. Well, the first thing on the list is leg straps on easy stands. It does need to be on when you're transferring somebody with the easy stand. Do we have any questions about that? That's just one of my reminders. They'll be educating on it, and then they'll email me that they told you if they catch you not using that leg strap. So then, we can't say you weren't educated, and then it's a verbal after that. Break times were a concern. We can't be taking breaks during meals. So for AM shift, it's starting about 10:15. If you can get started there with half an hour. And then either the nurse will go the last half an hour before lunch or after lunch, but nobody has to leave during meals anymore. And then for PM shift, it's when the short shift comes in at 4, they have to start giving the longer shifts their breaks. So, and then I know stuff happens, but in the best laid plans, it would be that. Otherwise, it's just where you fit it in. But for short shifts on PMs, when you get here, make sure your long shift goes on breaks. Any questions? Residents and phone calls. When residents get phone calls, the best way to take them is if you ask the person to take their number and then have the resident go down to our phone booth. They're tying up our lines and we don't have call waiting on the stations. So then the people calling in end up in a loop and sometimes their phone calls never get answered. So if we reduce the number of residents using our wireless phones, it shouldn't be as big of a complaint from the public. Any questions on that? Do you guys know where the phone booth is? Yeah, it's by Brenda's office. It says phone booth right there. Let's see. One of the biggest concerns in the month of February is the way that staff is talking to or around residents. We had a lot of concerns about what we were being relayed from residents. Like I was finding out who was in relationships and what they were doing outside of work and a bunch of stuff that was intimate or personal about the staff member. I can't go into detail, but when you're talking to a resident, just try to talk about the resident. You don't need to tell them who you're dating, what you're doing outside of work. You're in trouble, Heidi. Yeah, it's just not appropriate. And then even if the resident asks you an inappropriate question, do not, just redirect them and say, that is not appropriate. I do not need to tell you about that. Yep. Any questions on that? Because I shouldn't have to find out from a resident who's dating who on staff and what they did last night. And residents can hear it in the hallways. They can hear it when you're in their room with your partner. They hear it everywhere. COVID. Any questions on rest of that? No? Julie, nothing? COVID testing, that is for everybody that's not up to date with their vaccination. So that means you can be 2 weeks after your second one. And then depending on what booster you're getting or what vaccination you had. So if you had Johnson & Johnson, it's 2 months after you got that dose, you have to get another booster, or you have to go back to testing. If you got Pfizer or Moderna and your second dose is past 5 months, then you have to be tested if you don't get a booster. Does that make sense? Or is that really confusing?
That's confusing. I don't know if I'm up to date. I just had a booster.
Yep, so you're good.
Okay.
Yeah, no, and yeah, so like She just had a booster, but she would be considered up to date because she's still within that nice window of not
But I
needed.
have to get another booster at some point again.
They haven't really clarified if you need another booster or if you just stay once you get a booster.
Okay.
You
Um,
told me May, right?
Yeah, and then I believe I clarified with you. Yep, and then Heidi's leaving us, so. Is that a good enough guilt trip? Okay. This is our wheelchair scale is here and up and running. That is down in therapy. So if you have a really off weight, and the case manager will help determine if they will be using that wheelchair scale. The wheelchairs on the inside of the armrest will tentatively have how much it weighs with what in it. So I'll have a pad, if it has a pad or if it has pedals, it'll be labeled there with the weight. So you can subtract that from the weight of rolling them on and rolling them off. Any questions?
Worked pretty good.
Did it?
It didn't label.
Uh-huh.
Put it on the left straight. Yeah,
Exactly.
and it was exactly the same what it should have been.
Good. That's exciting.
Yeah.
So we ate about 5 to 7 people on it before we even let the residents use it. So, let's see. So yeah, so they'll be designated people, and you'll see it like on the wheelchair, or you can ask the case manager on your unit, or to know. Because I do not believe it's an option in PCC for wheelchair scale to grab. Okay. Wheelchair washing schedule, actually, I put one together and it'll be implemented on PM shifts, so I'm really excited over this, guys. Because, you know, when I have tended to see a lot of sitting around or being done really early on PM shifts, so we'll just find you guys a little task list to do, and working together. So our wheelchair washing schedule will be out at least next week. It'll be laminated in the nurse's station. You can write the month on it, and then you initial under what chair you wash that evening. And it's either 1 or 2, but it's wheelchairs, but it's never from the same station. That's more than 1. So, and that's color coded. So blue, solid blue, golden and golded. I have the instructions on how to use the wheelchair wash on that schedule. Do you guys know where the wheelchair washer is?
Across the laundry.
Yeah,
Right
it's in the wet room. It's in the dungeon. It's the big silver thing when you walk in to go and get a wheelchair or, I don't know, anything, equipment. Yeah. And Todd says it's about 10 to 15 minutes to dry it off. So they have soaker pads to put it, the wheelchair on after you remove it. And then, you just tip it back on its handlebars, let it drain, and then go get it in about 15 minutes and you can bring it back to the resident's room. So tentatively you would do it after they went to bed. And then it seems like a lot, but not every room has a wheelchair to be washed. And you can't put their bags or anything in it on the wheelchair wash, but you can run the cushions. But you could also do walkers if they don't have the mesh bag on the bottom. Let's see.
And they don't have a water guard attached to it.
Yep, and you gotta watch if they have a wander guard. TenaPass, I was having complaints that this was not getting done. This is also a PM task. On your charge nurse is going to get a list of things that have to be completed on each shift now for your CNAs, or just to double check. So it'll be like TenaPass, HS Snack Pass, Water Pass, wheelchair washing, and rounding before anybody leaves at night to make sure the rooms are in room order. Any questions on that? Any concerns with TenaPass? What time are you guys doing it on PMs?
If I work at PM, I do it right away when I pass them on in.
At 2:15?
Yes, but the only thing with Tenna is make one location for the briefs and wipes. Because some are in drawers and then others are in the bathroom, so you don't know how many are actually in the room.
Yep, and that is going to be a case manager decision, and we'll discuss that next week because I'm gone tomorrow. On the location for each unit to keep it, because when I did rounds down here in Golden, there was basins were on every sink. you know, and those things have to be put away. That's a dignity issue. So we went to put them in, they used to be in the bottom drawer of the 3-drawer stand in the nightstand. And when I opened one, it had a soaker pad. So then I opened our soaker pads, and then the next time the next drawer I opened, it had more soaker pads with briefs. And then so we decided to switch locations. Well, then we found another soaker pad. So, and then we're running out of linens and laundry to pass. So it's a all around organization issue that needs to be re-educated on. Any questions, suggestions?
If you're
concerns?
in a room and you see a stack of like 10 washcloths, take some of them out.
Yeah.
Because laundry needs them.
Yep,
I ordered so many washcloths and hand towels for them lately.
exactly.
Is there all that have a soaker pad in a room?
An extra one?
Yeah.
Well, and so it is, but you go, does the next person coming on know where it is?
Well, do you take them out of bed? Where do you put it? Cause I know just leaving it on the bed and making it bed, I don't know.
You can leave it under the sheet, but you can't fold it up and put it under their pillow. And if you're taking it off the bed, like some residents sleep on top of their blankets with one, when you're checking and changing them, that soaker pad used to live in the 3rd drawer, down with the basin. Not every room obviously is perfect, but that's where it used to be. But we're going to kind of tentatively put a little cheat sheet of that together too. Sorry, I'm going to make my note. I have it on my other sheet, but I'm just making sure.
Well, with like the tenant, when they're a Hoyer,
Mhm.
would it be like, would the location be changed if their briefs are already kept in the 2nd drawer? Like, would it be the same for every resident, or would it be different depending on if they're just a check on case?
Well, it all depends because on what unit, because Blue Horizon would be in the cubby.
Okay, well, on station 1, like, there's residents who just check and change them, and there's equipment in the bathroom all the time, so it's not like we can just.
Right, and Ruby Ridge used to have 3-drawer stands in the bathroom for select people that had a lot of briefs.
Yeah.
But they would also go, you know, to the 3-drawer stand if they needed to, but we'll lay it out and so you guys know the location of where we think they should be for you guys. And the other thing they were finding is they're running out in the AM of the tenant products, even if we're passing what's on the list. So if AMS is finding that, they need to report that to the case manager to report to Caitlin. Does that make sense? Yesterday we had a comment, or not yesterday, 2 days ago, we had a comment about being short in laundry, which we're just short a position. We're not technically short because we do have housekeeping picking up in laundry also. So the only thing we're really short in laundry is linens that are getting overstocked in rooms. Anything to add to that, Heidi?
So I see a lot of times that, especially on station 4 in the cubbies, if there's already 2 sets, when I passed on Monday, I was working on 4, there's like 4 or 6 sets in station 4 in the cubbies. It's like, that's where all of them are going. If there's 2 sets in there already, but there shouldn't be any,
Mhm.
but you should put 2 more in that
Right.
cubby.
Don't keep stocking.
Yeah, don't keep stocking. And then if you're seeing that, throw them into the laundry so then they can get rewashed to go back to the cycle.
Yeah.
Same
Because,
with,
like, some people have 6 in their bathroom and it's like,
yeah.
where they're going.
Exactly, and the same with washcloths, extras,
Yeah.
like Caitlin said, throw them into the laundry because we are ordering a large amount of them and
Please don't throw them away.
yeah,
Because
wash them out in the
Nick does a good job
hopper.
of bleaching them and trying to get out the stain, so,
Mm-hmm.
just don't throw them away.
Do you guys know when basin passes? Have you guys ever been told? So it's monthly, the basins are supposed to be replaced along with combs and toothbrushes, correct?
Yep.
And, so night shift is supposed to get them ready to go to be passed, and then AM is supposed to be passing them with cares. But when you're passing them, you also need to throw out the old stuff. So then we don't have an overabundance of that stuff in rooms. Do you guys have any question on that? In the
Like
garbage?
Like the base and everything.
Yeah,
Yeah,
in the garbage.
everything goes in garbage.
Unless you want to save them for oil drains or oil pans for draining. That's okay. We'll let you do that, Heidi.
It's okay.
Just please bring them out of the facility as you collect them.
Okay.
Okay. We had a request for street clothes on holidays, and that is okay. Like St. Patrick's Day is coming up, you can dress festive. You just can't wear the antlers that go into, when you bend over, go into the body of the resident. But you can wear them when you're not doing cares, but you can dress in street clothes or festive clothes. We also had a request for dress up days monthly, specifically,
Okay.
yep, pajamas.
The residents have had a lot of fun with that.
Yes.
It would-
hot.
Depending on the type of pajama, right?
Right, well, you can't wear your flannel dress,
Yeah.
has to be pants. Sorry,
Yeah, don't come naked.
don't come naked. Okay,
But I'd maybe not also come in a onesie, because yes, that'd be very warm.
yes, yes. Feeding, we're looking into getting a feeding assistance to help on Golden Meadow on AM shift. She finished basics, most of her basic care aid. She'll be finishing the rest with Cheryl, hopefully tomorrow. So then we can try to start implementing that and getting her trained. And it should be about 8 days out of the 14 up pay period that she's helping on AM shift. Oh, abductor pillows for hip fractures. Do you guys know how to place them? Are you guys having trouble?
The purple one?
Yep.
Yeah.
You get them all the way up into their pelvis and then you strap them on. And like we had one resident that couldn't straighten out her knee with it on. And when we see that and see the amount of pain, we should be notifying the nurse of any pain. But we, especially with hip patients, we need to watch it and make sure that they can get that in between their legs properly. Any questions on that? Yes. When a resident leaves leaves and returns for you guys, you need to notify the nurse that somebody's coming and going, and the nurse needs to document that the resident has left for an appointment or is leaving with family, and then what needs to document when they come in. So if you're seeing a resident like 2:20, go out with their husband, make sure you tell the nurse that they went out with their husband, so they can document it. And for nurses, which is Chris, we need to document for appointments like such as nursing home rounds or clinic appointments with orders. It's just something that spins off of that. Orders need to have a second nurse check, and I'll go over that a little more in depth. Nothing restrictions. Room assignments on Ruby Ridge and Blue Horizon will tentatively be changing. And we'll let you know when it's implemented. We're going to go to hallways with a float, like 3 hallways, and then have a 4th person float. And now that we have communications on our phones, we should be able to communicate with everybody. So we do have a walkie app, but we also have the one-to-one calling on the aerial system now. So those are a couple things to be looking on the out for. I will write it out, give you guys a map, tell you what rooms are on referred to hallway 1, 2, and 3. Your daily sheet will be changing, and it's just to kind of accommodate getting to be a facility versus unit to unit to unit. Because we're very separated from unit to unit to unit, to that I don't have to go down to help Ruby Ridge because I'm on Blue Horizon does not apply anymore. We have to be helping each other on all the units. Any questions? And then same with PM shift. If you're done, go check with the other units. I mean, Heidi looked at me like I was the smartest person in the world. When I sent her down to check with Ruby or Blue Horizon the other night to see if they were, no, Golden. I sent you from Blue. And they were all done and they didn't need her, but at least somebody went and checked to make sure they didn't need help. Any questions on that? Okay. That's when Jada was stuck with me.
Wasn't so bad.
So like I said, your charge nurse will get a task list that has to be signed out that you guys completed tasks every shift, because there's a lot of basic ones that are falling to the wayside that need to be completed. And it might be part of training that we are missing training you guys on them, but this way then we know that you guys know that they have to be completed and there's no ends, ifs, or buts about it. That HS snack pass, water pass, room order, room rounding, wheelchair washing, none of that gets missed, and that has to be done every PM. Any questions?
Question, because we kind of struggle on dams with waters too sometimes.
Mm-hmm.
We just set up our waters to be passed when we're doing cares in the morning. We go into every room.
Yep.
So,
And as long as the dirty ones go on to a clean or dirty cart versus going onto the clean cart with the waters. Does that make sense? So you have to have 2 carts, one for dirty cups and one for clean cups then.
can't just do a basin in the bottom of the.
Nope, the specific CDC guideline says that you have to have 2 carts to separate laundry and dishes and from clean to dirty now. Let's see. Cares are being added to knock shift. Very limited, but it will be meds with 1 or 2 people per unit. And we're looking at it to try to level out all the shifts, because AMs is so heavy on all 3 stations. PMs is getting all the extra wheelchair washing, which used to be on overnight, and then it went to housekeeping, and then it went nowhere. So that's just something to be on the lookout. It's going to be care planned if you have to do it. So it'll show up in your tasks.
So if we were free a night and we don't get to that person, like that happened this morning to me, I got one person up that can pick the other one up. Am I gonna get written up for that or anything, or?
As long as there's no complaints of watching TV, charting, how do we say? Watching TV, not doing anything. And we're seeing that, everybody's not changed. I feel as long as we try to make an effort and not just ignore the fact that these people need to come up and get up, and you communicate like, hey, this is what happened when it was care planned for me to get them up. But then there's special situations like Evelyn DeVere, who's restless at night, and one of her things she's care planned for is to get her up. So she's hanging out with you. Or if you see somebody just getting up on night shift and they're just restless, you can get them up and get them ready too, and just say, hey, I got this person up instead of this. You need to just, it's a communication. But as long as we're not getting reports of being on cell phones, watching Netflix, doing homework, just completely flat out ignoring everything, I don't feel like you'll get in trouble.
The amount of call lates, like this morning, I was going back and forth between him and answering call lates.
And you were on blue, right?
I was on Booty,
Okay.
but yeah.
I only looked at blue, so
But, yeah. Okay.
it's just if you have an effort. I mean, we're seeing a lot of just flat out refusals. And that can't be happening, because when you're assigned a task, we expect you to attempt and complete versus just ignore the fact that you're assigned to these things. And then if we're seeing that we're just as a trend, we'll probably reevaluate it as the fact that you guys can't get anybody up, on all 3 shifts. I mean, this is all 3 shifts now. If we can't see something that's happening continuously and we can't accomplish this, we need to figure out why we can't accomplish this. We can't just let that go to the wayside. Like Golden Meadow, we're trying to figure out the routine, get it down, because AMs are very heavy, but PMs are not. So what's the biggest difference? And which is why Golden got 2 like Ann and Karen, right? Or you haven't assigned them yet. Okay, but 1, and then it's to help with the burden on AM. It's not to punish you guys, which is the thought that I'm getting from people, is to do that, but it's to help help across the board. And we're trying very hard to keep it at 4 people right now. And I know there's been at least 3 nights since we've tried that we have not been able to accommodate that. Last night was 1, and then it was the previous weekend, right? But that's why we have pool staff here. We'll have break here, so then we'll have a couple college students coming back. We are writing out a contract for at least one of the pool staff, another one to come to night shift continuously. Julian should be back. So there's a bunch of factors in play that should help accommodate getting you guys to 4. And I know like there's people going to on-call, but as of right now, they're not quitting. They're just going to on-call, you know? So we're trying our best to keep them there, but I know there's a lot of issues also. And then like with night shift, you've been here a long while, Julie, but like your nurses have not. So there's a bunch of going to be retraining in general for everybody on night shift. When we go back up to 4, and this is what a charge list for you guys, like you guys have had and redone. Any questions on that? So if you guys ever work night shift too, it's a team effort. We have to work unit to unit. We just have to be smart about it. And the biggest thing is we work as units and we don't work as a facility. We don't accommodate or help or want to help our peers sometimes, it seems. So, the other thing is narcotic destruction. We're looking at changing the form for narcotic destruction. So if you're it would be TMAs or nurses. This is more for them. The form, we can continuously use the form. We don't need a new one every time we do the narcotic destruction. We can fill out the whole form. It correlates to the book that they're writing the narcotics in. And that form will be changing along with NARC count. We're going to look at putting the NARC verification sheet that's in the binder back into the narcotic book. So then you don't have to go there. The one thing with Chris and Julie, I hate to pull you guys up. Fridge temps aren't being done. So that's one thing to kind of start watching is the medication fridge temps daily have to be done. And I believe it's assigned to overnights right now, but it doesn't say that AMs can't look at it too and say, hey, why didn't this get done? Or let's go check the temp. Any questions, you guys? You guys are very quiet people. Chris, anything for them? Caitlin?
No, not for CNAs. No.
No, I don't have anything for CNAs either. But the biggest thing for me, you guys, right now is we need to work as a team. And we can't just work as an independent unit. I mean, the one thing I want you to walk out of here and say, Nissa said that a lot. Nissa means it. That we have to work and help each other unit to unit. So, okay, well, you guys are free then. And then we'll just record their stuff. Okay. Yeah, unless you have anything for else, any questions, anything? Okay, well, we'll stop recording.